Good morning. On Saturday, a steady stream of children, parents in tow, showed up at John C. Murphy Health Clinic in Berkeley. They may not have realized it at such a young age, but they were taking a huge step to protect themselves, their families, their teachers, and their classmates. Parents wanted to get their children back into the classroom this fall, but many had concerns about letting the little ones go into a school unvaccinated. The anxiety turned into relief on Saturday for so many parents who made an appointment to get their children ages 5 to 11 vaccinated. St. Louis County received 300 initial doses, much fewer than we thought we would have by the end of last week, but with more demand than supply, those appointments quickly filled up. However, we've been told by the state that we should have 3,300 more doses today or Tuesday. When in hand, the Department of Public Health will immediately open up appointments and will work quickly to help families get their children scheduled. Vaccine appointment information will be available at revivestl.com. We continue to work with pediatric care providers and will supply their patients with vaccine as more becomes available. We also are planning partnerships with schools to set up vaccine clinics as the supply increases. Getting our kids vaccinated in time for the holidays will allow families to gather indoors safely and enjoy traditions that were sidelined last year. Vaccines put parents' minds at ease that their little ones are protected from the virus and from passing it along to others. Over the next several weeks, as more of these child-sized vaccines are administered, we can look at 2022 with confidence that elusive thing called normal is within reach. Our daily case averages continue to trend down. The positivity rate is dropping. With each passing day, more people are getting vaccinated. In St. Louis County, 54% of our residents are fully vaccinated, and the overwhelming majority of residents have stayed the course and continued responsible actions, including wearing a mask and staying away from others if they feel ill. Without that compliance, we simply would not be seeing these promising trends. We hear the noise of the opposition. It's loud, it's distracting, and it's dangerous. It may give some people pause on vaccines. To anyone who has concerns about the vaccine, please contact your doctor. Talk to your child's pediatrician about the vaccine. It's safe, it's effective, and it is saving lives. I believe in science and follow science, and thankfully, the majority of our country does as well. The amazing strides made in science and research have gotten us to this point, a point where we can say with confidence that vaccines are a game changer and the way out of this pandemic. This pandemic has created strong partnerships, and we continue to build relationships that help us keep our businesses and schools open safely and our economy building back better than ever. As we move into 2022, the country will continue making vaccines widely available. St. Louis County will be working to implement that plan as well. We'll continue to finalize our plans on how to best use $193 million in federal relief funds. And the county has many needs, and the county council will be faced with prioritizing those needs to ensure we get the most out of those federal dollars. As we did with last year's CARES Act funds, we must allocate this money in an equitable fashion. Who needs help the most, and how do we use these funds to provide assistance? We must continue that commitment. We require vaccines for county employees. We want a safe workplace for everyone, and we want the public to be able to safely interact with our employees when they're in county buildings or out in the community. County government never shut down during the pandemic, and we will continue to bolster our efforts to make government work as effectively and as efficiently as possible. Thank you, and I would be glad to answer any questions.
Dr. Masco, COVID numbers have dropped significantly in some categories below where they were in September when the county reinstated its mask mandate. In some cases, pretty significantly below. And generally speaking, they're about the same range they were in May when the city and the county both dropped mask mandates originally. Does the county still need it at this point? Is there a timeline when you move beyond the mask mandate and drop it?
Yeah, so the question is about the timeline for dropping a mask mandate in St. Louis County and St. Louis City. We're working very closely with the Pandemic Task Force. We'll be meeting this week to discuss the trends, and we'll listen to their advice and the advice of our public health experts in our Department of Public Health, like we have from the beginning. We're watching the meters that the CDC has established on intermediate and low transmission. And you can follow along on our website at stlcorona.com. If you click on the data and reports link, it will take you to a blue and a yellow and red meter, and that will show the percent positivity and the number of cases per 100,000. And right now they're in the intermediate transmission rate, they're in the yellow. And we'd like to see that drop. We'd like to see it drop below 5% or below 80 cases per day. The other metric that we're watching is the number of cases, or the number of vaccinations that we're getting to our kids. The transmission rate in St. Louis County is highest among our school-age kids. And we're concerned about that because that's where people are gathering the most right now. Kids are gathering the most in school. We very much want to keep our kids in in-person school. And at this point, we see masks as a minor inconvenience to keeping kids in in-person learning, to keeping the cases down in school as we continue to vaccinate and start to vaccinate that 5 to 11-year-old age group. But the bottom line to your question about masks goes back to the advice of our public health experts and our scientists and our medical community that we followed since the beginning. And we'll see what the Pandemic Task Force has this week and their data and their advice, and we'll follow very closely the advice of our public health experts in our County Department of Public Health.
Did I hear you say, I just want to make sure our hand is right. You're saying you want the cases below 80 per day in terms of new admissions?
No, if you look at our website at stlcorona.com and click on the Data and Reports tab, there are two metrics that we're watching. One is cases per 100,000, 7-day average of cases per 100,000. And the other is the percent positivity rate. And we're watching that as well as how quickly we can get kids vaccinated. We would like to see the acceptance rate higher among adults than it is. We still have some hesitancy. And vaccination rate among adults has faded in our county, in our region, in our country. We still have some work to do there. But the biggest opportunity for vaccines is in kids 5 to 11. And we'll be working on that. As soon as we can get those vaccines in hand in St. Louis County, we'll get them in the arms of kids.
I'm sorry, so you want the cases per 100,000 in the 7-day average below 80 and the positivity rate below 5%?
Yes,
Okay.
that is our goal. And unless I have a different direction or advice from our public health experts, unless there are other variables that are reassuring enough that we could consider modifying that goal, that's our goal for now. But most importantly, we're going to follow the guidance of the Pandemic Task Force, which regionally has led our effort remarkably in our community and set us apart from other communities in the country, actually. And we're going to follow the advice of our public health experts in our Department of Public Health.
Do you feel like you're moving in the right direction toward getting perhaps without a mask mandate maybe by the end of the year? I mean, what's your feeling about the direction we're heading?
Well, cases have fallen remarkably since we've instituted a mask mandate in St. Louis County a couple of months ago. They've fallen remarkably, and we believe that the mask mandate has impacted that and has allowed our kids to get back into in-person learning. If the trend would continue, and if the vaccination rate among 5 to 11-year-olds goes as hoped, then it's certainly possible that we could be without a mask mandate by the end of the year. But it's hard to make that statement with the information I have today and without more feedback and guidance from the Pandemic Task Force.
Is the biggest thing moving forward vaccinations of these children aged 5 to 11, or is there still more work to be done with 12 and up as well?
There's more work to be done in 12 and up in adults, for sure. The biggest opportunity is with kids 5 to 11, because that group is not vaccinated yet. So that's the biggest opportunity. The things we control to move forward out of this pandemic are vaccinations among 5 to 11-year-olds, the remaining vaccinations on those 12 and over, and complying with our mask requirements in St. Louis County until our public health department says that it's a good idea, that we don't have to wear masks in indoor settings anymore, and until we get more direction from the pandemic task force.
You guys anything else? I think we're good.
Okay, thank you.